PSA, you said. So a PSA, does it tell you definitively that you have prostate cancer? Or suppose you get abnormal PSA tests. What else do you do to tell for sure that a patient would have prostate cancer?
Okay, so PSA and the other test would be other modality would be to do a digital rectal examination, in which we feel per rectally, like through the rectum we feel a nodule anteriorly, like just in the anterior part of the rectum, the frontal part of the rectum. If we feel uh, like the gland is enlarged, then we would suspect, or if it is firm, then we would suspect that the patient is could be having the disease, or if the PSA is on the rise. So PSA is not very specific. It can increase in various conditions like prostatitis, that is inflammation of the prostate, some prostate infection, and even a digital rectal examination can cause a rise in transient rise in PSA.
PSA, okay.
So even a biopsy from that gland can cause a transient rise. So what we do is we take a PSA level at least 2 to 3 times, and instead of seeing the absolute value, we see the trend.
Okay.
So if the trend is on the rising side, we suspect that the patient may be having the disease, prostate cancer. And then secondly, there is something called free PSA and total PSA.
Okay.
So we take the ratio of these two parameters, free PSA and total PSA. If it is somewhere less than 12 to 10,
okay,
then the patient is at a higher risk of having prostate cancer. Like if the ratio is more specific, then then doing a PSA
then you
alone.
do the further diagnostic tests.
Yes.
Like your rectal exam and your prostate biopsy.
Yes, yes.
Are these painful procedures?
They are usually done under the
anesthesia.
Yeah.